That's right, Contessa. The president has been pushing hard for a public insurance option, one that would allow Americans to choose between a government plan or their own private insurer. Well, Republicans are pushing back hard. Here's what New Hampshire Senator Judd Gregg told me just this morning.
You don't need a public option at all. In fact, a public option is simply a stalking horse for a single-payer plan, a system like they have in Canada or England, where the government basically manages all of health care, and you end up with rationing and delays, and as Senator McConnell said, you end up with a bureaucrat between you and your doctor.
Dr. Howard Dean is a former chairman of the DNC and former governor of Vermont. Chairman, governor, doctor, thanks for joining us. Good to have you here.
Thanks for having me on, Nora.
Let me ask you to address Senator Gregg's criticism. Is a public option a stalking horse for just government control?
Well, we've got to ask the Republicans to get the politics out of this and get down to work. Right now, there is a bureaucrat between you and your doctor, and it's a private health insurance bureaucrat. And what we want to do is give the American people a choice. Why the Republicans are always against letting people choose for themselves, I don't know. But give the American people a choice. Let them choose a public health insurance option, or let them continue in their private sector insurance. But the private sector hasn't treated people very well, and I think we need a public health insurance option for people to choose between.
Governor, you have the president going to address doctors, physicians at the American Medical Association, and they don't support this plan. Let me just read to you what the president of the AMA said. She said this, quote, "We absolutely oppose government control of health care decisions or mandatory physician participation in any insurance plan." So if doctors don't support it, why would this plan work?
What you just said is with the mistake. That's how the New York Times got themselves in trouble. I agree with what the AMA just said there. And I'm a big supporter of a public health insurance option. I think people ought to make a choice. But, you know, we're not, that's exactly the point. We're not trying to tell doctors what to do. We're trying to get the insurance companies to stop telling doctors what to do and let doctors be free. And they are free under Medicare. You don't have bureaucrats telling you what you can and can't do under Medicare. But you do have bureaucrats in the private insurance industry doing that. So the Republicans have got to stop this stuff. We need to give all we're trying to do is try to give the American people a choice between a system that is run by a fair intermediary, which is the government, to make sure that the insurance companies stop denying people coverage, stop taking insurance away when people get sick, and stop having bureaucrats tell the doctors what to do.
Governor, can you address the criticism that's been out there, though, that a government plan, why would we give, or a public option plan, would have the same kind of wasteful spending, et cetera, that Medicare and Medicaid have, and so why would we want to recreate and grow that?
Again, that somebody's making things up. In fact, the costs of running Medicare are much, much cheaper than the cost of running private health insurance. Medicare doesn't have to pay big salaries to the CEO. Medicare doesn't have to pay for advertising. Medicare doesn't have to give its big profits to investors because they're owned, but these are Wall Street publicly owned companies.
Doctors don't like it because they only get 80% of what they would under a private insurance plan.
Yes, and when we did something like this in Vermont, which resulted in every child in Vermont under the age of 18 had health insurance, we raised rates for primary care providers so that problem would be fixed. Look, I'm not trying to tell you that the government option is the perfect one. All I'm trying to tell you is let the American people choose for themselves, and you'll find the private insurers will behave much more fairly towards average consumers once they know there's going to be some place for consumers to go if they don't like their private insurance company.
And then finally, I do think this is a key point, Governor. If the average American has a choice then between this public or government option and their private insurer, how do you ensure that then employers don't drop coverage for some of their employees now that there's this safety net out there, which is a public option?
Well, the Obama bill says that it's pay or play, that if you do drop, then you've got to pay money into the fund. The other thing is this co-op thing. This is not a real compromise. This is a Senate problem. This is a fix for the Senate problem. It doesn't fix the American problem. I think the co-ops are a fine idea, but they won't work. And I love Kent Conrad. I think he's a great senator, but the co-ops...
He's a Democrat, too.
He's a Democrat. He's a wonderful human being, and I hope he gets reelected forever because he's just a great guy. But he's wrong about this. The co-ops are too small to compete with the big private insurance companies. They will kill the co-ops simply by undercutting them, using their financial clout to do it. In the small states like mine and like Senator Conrad's, you're never going to get to the 500,000 number signed up in the co-op that you need to have for them to have any marketing. So this is a compromise that's designed to deal with problems in the Senate, but it doesn't deal with problems in America. And I think it's time for the Senate to stop playing politics, do what has to be done. If the Republicans don't want to get on board, and they certainly have never done, look, the Republicans all were against Medicare when we put that in. If the Republicans don't want to get on board, then we can do this without the Republicans. We have the votes to do a public health insurance option without a single Republican vote and without the one or two Democrats that have said no. And if that's what we have to do, we've got to do the right thing for the American people, not the political thing for the Senate.
You're a strong voice on this issue. We're glad you were here. Governor, Doctor, Chairman, thanks so much. Appreciate it.
Thanks for having me on, Norah.